My name is Sam Hanna. I'm a dermatologist practicing in Toronto. I practice dermatology. I do both medical and aesthetic dermatology, as well as clinical trials. ReDexis has been a nice product to have. It really rounds out the line of fillers that I've been using. For many years, we've used hyaluronic acid fillers because of their ability to achieve the aesthetic results we want, but also their safety. It's nice to have a product that we can dissolve if there's an issue or a problem or a result that's unwanted. What ReDexis adds is with the addition of the Dextran beads, is a biostimulatory effect. That rather than the filling that we've traditionally done, these actually will stimulate collagen synthesis. And so the results are very natural and more durable over time as compared to the other existing hyaluronic acid fillers. At the same time, it still retains that safety profile that allows us to remove the bulk of the product, the hyaluronic acid, if there were an issue. It's been a nice agent to use in areas like the hands and in specific areas on the face where filling is challenging. So what Prolenium has done is developed this product that has, again, in addition to an HA, a hyaluronic acid, these modified Dextran beads. And the beads work in the skin by promoting the skin's own natural ability to produce collagen. It kind of turns on or turns up the machine that produces collagen. It does this in a way that's not particularly pro-inflammatory, which is important. So again, the modifications that they made to the Dextran, that's what that allowed, is low inflammation, but with the stimulation of collagen. Of course, that's one of the major structural components in our skin. So when you turn up the volume on synthesis, on production of collagen, you get a nice natural result in terms of filling that's quite durable. Well, one of the things that has been always of concern since the early days of filling is if there was an issue, whether an aesthetic issue where you saw a nodule or a bump, or you had a reaction that you didn't want. It was difficult when in the days, say, where collagen is what we were injecting, to know what to do about that. There were a lot of protocols about flushing the area and injecting steroid. Sometimes really the answer with those early fillers was you had to make a little slit and remove them mechanically or surgically or squeeze them out. Obviously not a great outcome when somebody's coming in for a cosmetic procedure. The hyaluronic acid era has really changed that for us. If you inject an HA filler into a patient and there's anything that they don't like or there's a problem, you can reverse it with the injection of an enzyme that is pretty readily available. And very quickly it takes away the filler. It breaks it down. It's particularly important in the thankfully rare scenarios where we have problems like filler sitting on top of, or especially in blood vessels, where you can see some issues of vascular compromise, blood vessel compromise, and that might lead to tissue death or other really serious complications like blindness. It's particularly helpful to have something that can take that product away very quickly in short order in the moment. It's a pretty safe thing to use, hyaluronidase. It's because of its source, you have to be a little concerned about patients who have allergy to bee or wasp stings, but otherwise it's quite safe to use and really has afforded a lot of safety to the HA class of fillers. So ReDexis, can be used anywhere where a traditional filler would be, but I really have found it to be particularly helpful in the lower face in redefining and redraping the jawline, as well as in the tops of the hands. Sometimes you'll see people with more prominent, as they get older, loss of fat between the tendons. You start to see the tendons. And, they find that they want to have a bit of improvement and reduction and more youthful fullness in the hand. So those are the primary areas that I use it in. Though I know others have employed it in other areas as well. Well, I think there's a number of things. Really, the reduction in the limitation, let's say, in inflammation was probably one of the big deciding factors for me. It's on a lot of other fronts an equivalent product, it seems, in terms of duration. So it lasts as long as similar products in other lines. It's as well tolerated, we get as nice cosmetic results. But at the moment, at the moment of treatment, it seems that it produces a bit less inflammation, and that's been nice. Again, it's nice that it's made in Canada. I'm not sure that anybody would necessarily switch there. Though one advantage that does have is it's a really world-class filler at quite competitive prices. So for the practitioner, that makes a difference. Sure, Polenium is a company that I've been very happy to work with over the last couple of years. For many years, we've used a lot of different fillers from a lot of different companies, and there have been a lot of good products over the years. Polenium, it's nice to have a product that's homegrown. They have a state-of-the-art manufacturing facility in Aurora, Ontario, that produces a really world-class filler. Their filler line is used in lots of countries around the world, in Europe and South America, and in the Far East and in the Middle East. And it was very nice to have access to their products here in Canada. It wouldn't have been enough for them just to be Canadian, so it's particularly important that they made an excellent filler line. These are well manufactured, they understand the science of producing fillers, and they've managed to produce products that rival or exceed products that have been around for a longer period of time. One of the things that I certainly have noted in using their products is the reduction in inflammation with some of the product line that I see. And that's certainly important for patients who want to have a nice aesthetic improvement and get back to their lives. I noticed that they leave with a little less inflammation right away. And at the same time, I'm seeing nice results aesthetically and durable results comparable to other products that we've seen. So on all fronts, it's been a good relationship to have, and I'm pleased to have Polenium products in my office.